This is a case of a fracture through a fusion mass, which I feel is interesting. 83-year-old, 80, I think 84-year-old woman presented with low back pain. This was her x-rays, which showed pedicle screws from T10 with a lot of kyphosis above it, all the way down to L4 and a mature fusion mass from L4 to the sacrum. Her history is she was fused at L4, L5 posteriorly, non-instrumented in 1960, then a fusion L5S1 non-instrumented in 1961. So she was fused from L4 to S1 bone only. And then she had sequential adjacent segment degeneration fusions spaced 5 years apart, L3, L4, then L2, L3, then L1, L2. And her last surgery was T10 to L4 fusion. And she did well for a while. You can see a CAT scan from 2018 shows a mature posterior lateral fusion mass, and an MRI from 2019. She had a fall in 2020, which shows a fracture, basically a three-column fracture through L5 and also through the pars of L4. Um, you can see the robust posterior lateral fusion mass. So basically, she fractured through a fusion mass. And the question is, when you do these big revisions, should you instrument the whole spine? I personally do that. That way, I feel it'll avoid this problem. Although there's always a chance you can fracture through S2, S3. And some people talk about bending of the fusion masses. I'm not sure that's completely true. But I thought this is a very interesting case of fracture through a fusion mass. And it's one reason why you may want to instrument the entire fusion mass. I would probably just would have put a screw in S1, which is very simple, easy to do. Maybe, or the alien maybe would have avoided this. So the fracture through the fusion mass. I hope you guys find this interesting.